Summertime can bring fun activities like concerts, air shows, and fireworks displays, but those favorite pastimes can be tough on your little one's ears.
Certainly. Dr. Dominic Lucia, Chief Medical Officer at Baylor Scott & White McLean's Medical Center, is here now to discuss. Welcome, Doctor. Thank you for joining us. First of all, how do loud noises impact children in those young ears?
Well, it's a really big deal, actually. We forget how sensitive and how fresh that hearing is when a baby's born and through childhood, because a lot of times into adulthood, our hearing's already been slightly damaged, but it's a serious issue. The American Academy of Pediatrics says that it's really a public health issue and estimates that around 12% of kids between the age of 6 to 19 have some noise-induced hearing loss. So it's a real deal.
I know my kids don't even like the sound of a flushing toilet. Like they really are, but I'm like, you still have to flush it. But how do we know if something is too loud for our kids?
Yeah, so if you're in an environment and you have to raise your voice 2 to 3 feet away just to get their attention because the ambient noise is so loud, that's a good clue for starters. If they don't respond when someone next to them actually responds, that's also a really good clue. A lot of times this comes down to not only the noise level, but the duration they're exposed to it. So for instance, being exposed to a lawnmower for 30 minutes can damage hearing, whereas just being exposed to like a jet engine for 30 seconds can damage hearing. So it's really that balance of decibel level and the duration they're exposed to it.
Yeah, that's a good point, Doctor. Okay, I'd like to go back and talk to my younger self and say put cotton in your ears at the Metallica concert that you were at. So what kind of activities should we watch out for here for the younger kids?
Well, certainly concerts, air shows, fireworks. I think we're past the big firework part of summer at least. But noisy toys, there's so many insidious ways that it leaks into our lives, that wearing headphones for too long, and a lot of times the children are on the iPads and we don't want to hear it, so we tell them put on headphones, but oftentimes they're listening to it too loud. Even the noise machines that we have to keep the babies asleep can be too loud too. So if you have questions or you're worried about your child's hearing, talk to the pediatrician, talk to the family medicine physician, because they can get a hearing screening done for your child or infant.
Yeah, great point there with the headphones.
Yeah, so how do you know if your child has suffered some hearing loss already?
Yeah, it really comes down to picking up on those clues. So first is awareness, one of the reasons we talk about this today. But if you're in a noisy place consistently and they say something sounds muffled afterwards, or they're hearing ringing in their ears, or again, they're not responsive when other kids are or even adults are, that's a good clue that you may want to get their hearing checked.
All right, last question for you, Doctor. Is there anything really we can do to prevent it? We always care so much for our kids. We want to do what's going to keep them safest.
Well, beyond the cotton balls that you mentioned, there are some pretty sophisticated things out there for kids that are relatively inexpensive. So for the older kids, certainly earplugs, those can be easily obtained now. And when infants, if they do have to go to something loud or a sporting event, etc., there's these great little ear mufflers, earmuffs that are pretty easy to obtain and inexpensive. So just be thoughtful, pre-plan ahead. Know that you want to preserve that really fresh, good, excellent hearing that your infant or child has for as long as possible.
And I have seen those earphones, like the ones I use for mowing the lawn and weed whack, and they're little tiny ones that are meant for little babies, and they're comfortable for them too. Doctor, great advice today. As always, we appreciate your expertise. Thank you for joining us.